Hi there, and thanks for joining us as we get a good drug picture of the non-steroidal anti-inflammatory drugs that inhibit the action of cyclooxygenase 1 and cyclooxygenase 2. Ibuprofen, indomethacin, and naproxen are examples of non-steroidal anti-inflammatory drugs that inhibit both COX-1 and COX-2. The term non-steroidal distinguishes these drugs from the corticosteroids. And the corticosteroids have a much broader anti-inflammatory effect than the non-steroidal anti-inflammatory drugs. These drugs affect the cyclooxygenase 2 enzymes that make inflammatory prostaglandins. And by decreasing the inflammatory prostaglandins, we reduce pain, decrease fever, and in higher doses, decrease inflammation. But the problem is that we also affect the cyclooxygenase 1 enzyme that makes protective prostaglandins. So let's take a look at what this enzymatic inhibition ends up doing. Transmission of pain involves three what we term orders of neurons, beginning with the peripheral nerve. And different analgesics work in different portions of the pain pathway. The non-steroidal anti-inflammatory drugs work primarily at the beginning of the first order of neurons, so right here. At that point, there's nociceptors, or pain receptors, that are close to the skin's surface. And when we, for instance, cut our finger, there's membrane depolarizations that begin right there. And then they travel up the first order of neurons, the second order of neurons, the third order of neurons, and they're ultimately, those messages are interpreted by the brain as pain. When we cut that finger, a number of immune cells and local cells start the inflammatory process. For instance, the mast cell immediately releases histamine, which is kind of prepackaged already. The mast cells and other cells in the area are going to start using the enzyme cyclooxygenase 2 to start forming inflammatory prostaglandins. Now, the inflammatory prostaglandins do a number of things to increase the inflammation in the area. Those prostaglandins also sensitize the nerve endings in that area. And then why would we do that? Why would we sensitize the nerve endings so that we feel a lot of pain? Well, the reason is so that we inform our brain that there is something there that we need to take care of. And another thing that happens with the inflammatory prostaglandins is that they cause a fever. So if the area is big enough, or if it starts getting infected, there's going to be more prostaglandins released, and those are going to go up to the thermoregulatory set point in the hypothalamus and tell the hypothalamus that it's in our best interest to start raising the temperature. That is why the non-steroidal anti-inflammatory drugs decrease inflammation, decrease pain, and decrease the fever, just simply by decreasing the cyclooxygenase 2. Perfect, right? Well, the problem is that all non-steroidal anti-inflammatory drugs, except for aspirin, actually increase the risk of thrombotic events such as myocardial infarction and stroke. The non-selective non-steroidal anti-inflammatory drugs such as ibuprofen, indomethacin, and naproxen seem to come along with a bit less of a risk than the selective ones, but nonetheless there is an increased risk. And the other problem is that these non-selective non-steroidal anti-inflammatory drugs also affect the cyclooxygenase 1, or COX-1. And COX-1 is an enzyme that's used in many organs in our body to make protective prostaglandins. And the prostaglandins that are used in maintaining homeostasis. So for instance, in the GIT, there's one problem with the acidic nature of the drugs damaging the linings, but also there's less protective prostaglandins, which makes it very possible that the person could develop stomach ulcers. And in the kidneys, there's an inhibition of the protective prostaglandins that are going to lead to a number of renal disorders, especially if the non-steroidal anti-inflammatory drugs are taken with other nephrotoxic agents, or if they're taken when not fully hydrated. And also decreasing those prostaglandins decreases the excretion of fluids, and therefore that leads to hypertension and fluid retention. And then finally, the non-steroidal anti-inflammatory drugs also affect platelet aggregation. So it's important not to combine these medications along with something else that can affect bleeding, for instance, warfarin. So ibuprofen, indomethacin, and naproxen are used primarily to treat fever and reduce pain from painful conditions, especially if they involve inflammation. But one thing about all analgesics is that none of them are going to be effective in all people, and none of them will be effective for all types of pain. Only about 60% of people respond to any given non-steroidal anti-inflammatory drug. So if the individual or if the individual's specific pain at the time is not responding, another non-steroidal anti-inflammatory drug or painkiller is probably more appropriate. Aside from the adverse effects that we've already spoken about, including the risk of stomach ulcers, increased risk of kidney disease, fluid retention, and hypertension, these drugs can come along with some other effects such as nausea, dyspepsia, diarrhea, and constipation. A lot of those side effects can be decreased if the medicine is taken with food.